Hey guys, this is Samantha Franzen with Decidedly So, and I'm here today with my friend Perry.
Hi.
We are coming at you to talk about something that is really pertinent to this month in general. October is all about, everything is pink and it's breast cancer awareness, and something that I really wanted to touch on and talk about today is this concept of prevention and some of the things that we can be doing in our day-to-day schedule, day-to-day routines to help us either catch things earlier or some of the changes that we can make that might prevent some of that exposure, whatever that looks like. I saw a statistic the other day that talked about 85% of women who are diagnosed with breast cancer have no genetic familial connection to breast cancer. And so it's really important for us to talk about these kinds of things. So Perry is an absolute guru. She has a really great YouTube channel, and I've talked about her and referenced her a couple of times before in some of my videos, but she does a lot with hair and makeup and really helpful tips and tricks in that capacity. But I've joked that she's like this Renaissance woman because not only does she have that incredible base of knowledge, she also is a registered nurse. And so this last month, I was kind of breezing through some magazines and came across an article in this magazine that talks about the top breast myths that are now busted. And one of those talks about the American Cancer Society has in recent years not recommended that providers teach formal breast exams to their patients, and that is a busted myth. We're here.
It's ridiculous.
We're myth busters today. Yeah. So I reached out to Perry, knowing that she's an RN, and just asked if she could help me, and obviously you guys get a better base for how you conduct that exam, and how you can, we talk about all the time on this blog and in the videos that I do about know better, do better. That knowledge is power, and when you have a baseline for what it feels like to have normal breast tissue, that you can catch some of those deviations and irregularities a lot sooner and easier.
Yeah, absolutely. And thank you, Sam, for having me on your channel and the kind words that you had for me. I by no means am a doctor, but I do think that us women, we can empower each other and provide tips and tricks or knowledge, or phrase things a different way so that we can all know better and do better, just as Sam said. So I think that this is a really genius, spot-on idea for the month of October. And if it's information you already know, great. If it's not, hopefully this helps. Yeah. So yeah, let's talk about breast exams.
Cool.
And so awkwardly, I'm holding this breast this fake breast right here. It is a prop, obviously, and it's super dorky, but in all seriousness, I did want to use like a visual prop to show you guys what to be looking for. So around the areola, I want people to know that you pinch and let it kind of get taut. Look for puckering, look for retraction in the nipple, look for dimpling around the nipple. As the nipple gets hard and gets taut, if there's a tumor deeper in the tissue, it can cause different types of changes in your nipple and your breast tissue. So first start with the nipple and kind of go in a circle and see if there are any changes. And then, using the first 2 or 3 fingers, go in your counterclockwise motion and feel for deeper, hard, irregular shaped nodules that aren't moving around freely, but that are hard usually. It's kind of hit or miss whether tumor tissue is painful, but if it's irregularly painful because you're doing your self-exam regularly, that's when it's worrisome. And as you work your way out, just make sure that you extend all the way up and towards the clavicle and up high, and then down towards the upper abdomen and feeling tissue all around there, because breast tissue actually doesn't just reside in the perky part of your breast.
Wow.
It extends.
Right.
And that's another point I'd really like to drive home, is that you need to check all around so that circular motion you're checking for extends all the way up and down, and then also up into your armpit. I know that when I started breastfeeding, I was like, what is this feeling? What are these bumps in my armpit? It was breast tissue.
Right.
And there's a lot of lymph that lives in your armpit.
Right.
And breast cancer can reside in that kind of tissue.
Right.
So you need to check up in your armpit, up in your brachial area, and then down.
Wow.
And do it on both sides.
I didn't know that.
Just to compare. And do the same thing every time so that you know when something's not right, you catch it.
Right. That's such helpful information, because I know personally that, I mean, as you're talking about like the engorgement factor with breastfeeding, like I can definitely that into your armpit, but
Right.
I don't think, I mean, I've never thought to extend that check into my
Right.
armpits. And even, I mean, that's not a conversation that I think anybody's
Right.
ever really cued me into.
Well, with hormones too, like so pregnancy, postpartum, or even just your monthly cycle, the hormones can change your breast tissue. So it is important to know your baseline, because when changes happen, you can notice, okay, there's a subtle change, there's a big change, but
Right.
you know your baseline. And I know that they say a minimal, do it once a month, a few days after your period, because that's when you have the least amount of swelling. But I tend to think that it's best to just at least do your physical exam on yourself when you're taking a shower, because you have that slip and you're already feeling your entire body because you're cleaning it.
Right.
So it's
Good and
important.
lathered.
Yeah. Yes. It helps with the movement around the tissue.
I love it.
One more thing I do want to talk about, in addition to the manual physical exam that you should do on yourself, whether it's in the shower or pre-post shower, is make sure that you are looking in a mirror to get that visual exam, comparing each breast to each other. If there's puckering you can't see by just looking down, dimpling, if there's some discoloration that wasn't there before, different skin texture. Visual exam is really important as well. And then also, I just wanted to touch on nipple discharge a bit. It is important, especially as mothers that have been nursing, that you know the difference between abnormal and normal discharge coming out of your nipples. If there is a bloody or irregular colored discharge coming out of your nipples without stimulating the nipple tissue, that is of concern. If you're just engorged and you need to nurse your daughter or son and milk is just dribbling out, that is different. But and also, been there, done that. In all seriousness, though, you know your body best, and just be aware of what is going on with your breast tissue and what's coming out of your breast tissue. That's why self-breast exams are so important, because it is a part of your body. You know what is your baseline, what is normal and what is not.
Right.
And I think that's the main message you and I want to drive home.
Yeah.
Is that's why this is a myth we need to bust.
Right.
You need to do breast exams at home.
Absolutely.
Don't wait a year to do them. Do them minimally every month.
Yep.
After your period, it'll remind you, I need to do my breast exam.
Right. Well, it's so helpful, and like you said, just having that baseline is really powerful. So I hope for everybody that this information is helpful, and honestly, if it's something too that you feel like there are women in your life that could benefit from this information, share this video. I feel like for us to come together, that the core value here is connection and taking care of one another. And so that's what I really hope that we can convey today, is just take care of one another, take care of your body, know your body, and thank you guys for joining us.
Thank you. Thank you for watching our video.
Yes. Take care,
Let us
guys.
know if you have any questions. Yay. Bye.